immediately. This will ease the access and the workforce pressure that continues to present significant challenges across all care sectors. If the government really wants to tackle this crisis, they must reinstate levels of access of care that was back in before 2010, and it was under the last Labour administration.
Neil O'Brien.
Speaker, I'd like to start by thanking ministers and thanking everybody at University Hospitals Leicestershire for the role that they've played in securing the fantastic £450 million investment in our local hospitals that was announced the other day. And I'd also like to thank ministers for the role they've played in today's announcement that there's going to be a £46 million new investment in an urgent care hub at Kettering General. And that means that constituents of mine at both ends of my constituents are going to be benefiting from huge new investments. I'm incredibly grateful. And those are not the only pieces of good news we've had recently in my constituency. We've got the gleaming new treatment centre at St Luke's in Market Harborough. We've had the wonderful news that we're going to be keeping the world-leading Children's Heart Unit at Glenfield, a service which is not just brilliant for everyone in this country, but actually through the charity Healing Little Hearts, actually provides help for people across the entire world. And we've also got the futuristic new A&E at Leicester Royal Infirmary. And these are all great, but the investment that we are about to receive will be even more transformational. And the Secretary of State came the other day to the Royal Infirmary, and as we walked around, we heard about both the challenges but also the opportunities that we've got locally. We saw the difficulty of working maternity split across 2 sites. When my son was born just 2 weeks ago, and I saw how having 2 different sites meant that the staff there had to work all day without breaks to fit us in. And their lives and patients' lives will be much better once we have a single new maternity hospital. We saw, as we walked around to the Secretary of State, the brilliance of our intensive care staff, but we also saw that they were working in fundamentally out-of-date facilities. And we saw the brilliant work that the A&E team are doing, particularly in harnessing data to improve services. But we also saw the incredible growth of demand for those services. Now, the investment that we're about to get means a new maternity hospital, a new children's hospital, 2 super intensive care units with 100 beds in total, a planned new major treatment centre at the Glenfield Hospital, modernised wards, new operating theatres, new imaging facilities, and brilliantly new additional car parking. And anybody who's ever tried to park at Leicester Royal Infirmary will realise that that's a huge boon. And these local improvements are part of a wider series of improvements we're making across the NHS. It's great that we now have a long-term plan for the NHS, a long-term budget for the NHS that allows NHS managers and staff to plan for the future. I will give way to the honourable member for Shannon.
The honourable member for Strangford, the last name Shannon. Madam Deputy Speaker, I very much welcome government's commitment and the money that's set aside, but does the honourable member, or is he aware of the 16 million people living with a pain of musculoskeletal condition in England itself, and how will government ensure that people with arthritis are able to access the interventions that need to be in place, from joint replacement operations to physiotherapy in a timely fashion? I think there's an opportunity to do that, to address those issues. I know I have the same problems in my constituency, but it's a devolved matter. But here in England, I've been made aware of that. Does he feel it's time to do that as well?
Gentleman raises an important point, and I was actually about to come to this, which is the point that it's great that we are making record investment in services like mental health, spending more than before. Great that we're introducing new targets like basic standards for help with eating disorders. It's great that we've got more doctors, more nurses, more money, but you are conscious as you speak to people in the NHS that unless we can deal with the sources of demand, fundamentally you'll never be able to spend enough on all the priorities, including musculoskeletal services. So what do we need to tackle those causes of demand? We of course need the long-term plan for social care. The Minister needs to stick to his guns on public health. The sugar tax has worked. Things like the campaign against the anti-vaxxers and their pseudoscience, that's incredibly important. And action on preventative social care is incredibly important. We should keep going on things like the migrant health charge. It's raising money for the NHS. We could increase it. We could keep going on technology. So important if ministers could help GPs to upgrade their telephone triage facilities. That will make the experience of using primary care so much better and take down the burden. But some of the things that are in this Queen's speech are also incredibly important to help deal with these growing burdens. We need new technologies. That's why it's important to get more clinical trials going more quickly. That's why I welcome the measures in the Queen's speech. It's building on the Life Sciences Review, the Bell Review. It's very, very important to build on the work that the academic health science networks are doing to get, the potential advantage of our NHS is it should be one of the best places in the world to do clinical trials. We've got the scale, but at the moment there are too many gatekeepers and too many things stopping them. And last but not least, of course, there's the wonderful improvement in the NHS safety body that we're creating. Now, from personal experience, my daughter was born. Some things went wrong. We had a wonderful registrar, junior registrar, who did lots of things right, but a few things went wrong. My wife gave birth without anaesthetic. And then after that, unfortunately, a placenta didn't deliver, and a consultant, and we never found out who this was, removed the placenta manually with no anaesthetic, and that was incredibly painful for my wife. And so it is important, as the member for Harwich and North Essex said, that we learn lessons in the NHS without attributing blame. Not attributing blame was one of the fundamental recommendations following the Mid-Staffs inquiry. You've got to be able to learn lessons. Now, when we started complaining about what happened to my wife, that people kind of closed ranks, and we would never in a million, my wife is a doctor, and we would never in a million years sue the NHS, but they didn't know that. And so we never even found out who the consultant was that got things wrong. And so I don't know now whether the lessons were learned from that mistake or whether they weren't. I hope they were. But having a no-blame culture, having this new body, learning from the experiences of painful things like the Babagarwa case, is the way that we can have truth and reconciliation, and where we can have a system that learns. That is one of the most important things we can ever do to improve the NHS, is to make it a system that is a self-improving system that's constantly learning and constantly getting better.
Gio Moore.
Thank you, Madam Deputy Speaker. And I want to start by thanking all the NHS workers from wherever they come from in the world who do such fantastic work for the health and well-being of my constituents in Newcastle. And I do want to reiterate all that has been said about the devastating impact which any Brexit, but particularly a no-deal or hard-right Brexit, will have on the NHS and on our European Union brothers and sisters who work in the NHS in Newcastle and across the country. The Labour movement fought for the NHS because working people understand the terrible consequences of ill health for those without any means. And just as under this government the gig economy is bringing back types of job insecurity that we thought the Labour movement had banished from modern-day society, so this government's backdoor privatisation is undermining our NHS. My right honourable friend, the Shadow Secretary of State, emphasised how that is driven by an ideology, a right-wing ideology, and I want to highlight a particular area in which this is particularly obvious, and that is in the requirement for competition in primary care, particularly for GP surgeries in poorer areas. Now, there's been more a rise in poverty under this government, and with poverty comes increased health problems. GPs working in areas with higher levels of deprivation have higher levels of workload, and patients with more complex needs. GPs are choosing to work elsewhere because of the lack of support that the government offers, which exacerbates vicious cycles of health inequalities. And when it comes to GP contracts, there are requirements that they be competed for, even though there isn't anyone willing to compete. So this means that contracts are returned early after 2 or 3 years, and my constituents do not have the continuity of care, the high-quality continuity of care that they deserve. The government is requiring competition even where the private sector cannot make enough profit to be interested in competing. Now, I also want to highlight the growing health inequalities, which mean that more socio-economically deprived areas that there is less access to health care. So, for example, in Newcastle, we have cervical screening rates of 85% in Gosforth, a wealthier area, and only 23% in Westgate, one of the poorer areas. And in the northeast has the highest level of epilepsy in the country, with poorer people more likely to die from epilepsy. And as today is SUDEP Action Day, I particularly wanted to highlight the work of SUDEP in combating rates of epilepsy. Higher health inequalities under this government mean that more people are dying and suffering unnecessarily. Madam Deputy Speaker, I also want to talk briefly about the privatisation of NHS data. I understand that at the moment the Office of Life Sciences is assessing the value of NHS data as part of the Life Sciences Industrial Strategy. This is in the absence of a regulatory framework which gives patients control over their own data and therefore leaves it open to being sold off as part of a future trade deal, something the public is completely against. And the fact that the Department for Health did not take up the Great North Health Record, which was an opt-in rather than an opt-out health record, means that these dangers are all too obvious. Madam Deputy Speaker, I want to finish with two areas which in themselves deserve hours of debate, and that is mental health and social care. In Newcastle, mental health, particularly for young people, is a rising issue which is raised with me by police, schools and housing, and we have yet to see real parity of scene. And when it... I will go, thank you.
I've got a member of my way, and she mentions mental health. One of the issues that, and I know Northern Ireland is devolved, but right across the United Kingdom, the message that we're getting that we need to have more trained nurses in mental health, especially for young people. And of course, we have the figures are startling within the United Kingdom, where just over 10,000 young people, approximately under the age of 10, are manic depressants.
Thank the honourable gentleman for that contribution, and that is why mental health has been raised with me consistently by youth groups and youth organisations, and the cuts to mental health, and particularly mental health nurses, are so particularly regrettable, and we need to see much greater choice and autonomy in mental health so that services are designed in mind and by those who are using them. When it comes to social care, Madam Deputy Speaker, until the government realises that high quality social care by properly paid professionals is not a cost bucket but an enabler of a more equal economy and a fairer society, then I'm afraid I will continue to see constituents, friends and families having to face devastating choices because their loved ones are deprived the dignity they deserve in old age because we do not have a fair and consistent social care policy in this country.
Order. I have a little bit of good news, which is that because some colleagues have indicated that they're not going to attend the debate, I can put the time limit back up to 6 minutes. Andrew Selous.
Thank you very much indeed, Madam Deputy Speaker. And I must say that I do wish that this House had been completing the really important and necessary Brexit legislation today. But having said that, it is always a particular pleasure and indeed a responsibility to speak on the important subject of the NHS. And I too would like to start by thanking every member of the NHS for what they do. That actually includes 2 members of my own family. The pressures on them are unrelenting day in, day out, and all of us need to acknowledge that in this House. And I too have personal reason to be hugely grateful to the NHS. At the age of 24, it saved my life with an emergency operation in the hospital just over the river in the middle of the night. I had a hemopneumothorax, and I would not be here today making this speech if it wasn't for the brilliant care that I got some 30 years ago. Now, carrying on looking at the staff within the NHS, having met with a number of the presidents of Royal Colleges last month, they said to me that they think we actually need to double the number of medical students that we are training. Brilliant news, we recently increased that by a quarter. The level of demand is such that we, with the people review going on in the NHS, are going to look to need to double that. It is also something I think we need to look at, that I understand the evidence is that up to 1 to 3 hours of every day of the work of a doctor could be done by non-clinical healthcare staff, and we need to think about that, so we are using our staff as effectively and appropriately as possible. It does hugely concern me how many medical students we lose from this country who we train at public expense, who then go off to Australia or to Dubai or somewhere else. Are there some perverse incentives in the system? And actually, where is the value for money for the taxpayer after we have trained them? I also hear from staff that sometimes they are working with computers that take half an hour to warm up. And yes, we want to get rid of the fax machines, yes, we want the latest technology, but computers that just turn on and work are really, really important for NHS staff under pressure. We need to look at putting more nurses into care homes to stop inappropriate visits from their care home residents to accident and emergency services. We need to make sure there are enough practice nurse courses in rural areas. There are gaps there that is leading to poaching. We could perhaps use the apprenticeship route. I understand that of medical school students who graduate, 27% of those are going into general practice, but I understand from the Royal College of GPs that needs to be nearer 50% in order to meet the acute need for doctors in GP practices up and down the country. And there is also very great variability in the proportion of medical students that go into general practice from our medical schools, and we need to learn to raise the proportion going into general practice because that need is so acute. I'm also concerned that we don't have a proper career path for associate specialists, particularly in surgery, in our hospitals. These are very valuable members of staff, but they can drift around the system a bit, and I understand about 20% of them are leaving, so we need to look after them better and plan for them more appropriately. We need to link our health visitors more closely with the new primary care networks. Health visitors do invaluable work, in particular their national child measurement data doesn't get transferred to GPs in the way that it should do, and that leads to problems not getting on top of childhood obesity. And on the issue of childhood obesity, as a co-chair of the all-party parliamentary group on obesity, it's great we've got Chapter 3 of the Childhood Obesity Plan, but I would just remind the Minister the actions from Chapter 2 that we've not yet implemented, the watershed, promotions and point of sale, we do need to see implementation on them. We also have a very bizarre issue, and that the Quality and Outcomes Framework doesn't cover children's weight. In fact, it specifically excludes it. It only covers adults. Come on, we need to vary the contract to make sure that that does measure children's weights. And we must do better on fetal alcohol syndrome disorder. I think we need that in PSHE. We need a massive public campaign on that. I'm awaiting a letter back from the Secretary of State on that. It is a huge and growing issue that we don't talk enough about in this House. Madam Deputy Speaker, we live in an obesogenic, polluted environment with unacceptably low levels of active travel. We need to design the healthy environments of the future if we are going to relieve the NHS of pressures which are otherwise going to overwhelm it. We also need to be aware of the opportunities that NHS staff have to spot incidents of modern slavery. And I would like to commend a very alert healthcare worker last week on the eve of Modern Slavery Day who spotted the first victim of modern slavery in her hospital because she was alert to the symptoms and she'd done the training. NHS staff have a unique opportunity to bear down on modern slavery, and that's so important. And I was staggered to hear from the SNP spokesman that the taxpayer is paying £80 billion out for £30 billion worth of hospitals. I think that was the figures that she told us. For £13 billion, so it's even worse than she said, and some trusts paying up to 16% of their income on PFI payments. You know, we really must learn and do much better than that.
Alex Norris.
Thank you, Madam Deputy Speaker, and it's a pleasure to follow the honourable member for South West Bedfordshire, whose personal leadership on modern slavery is something that we very much appreciate in this place, and today we may well have seen a reminder of why it's more necessary than ever. I made my maiden speech in the Queen's Speech debate. Google tells me 848 days ago, which is very strange, Madam Deputy Speaker, because it simultaneously feels like a lifetime ago, but also like yesterday too, so perhaps that's what those days have contained. And they have been very strange, tumultuous times, and if you told me things then that subsequently happened, I probably would have been sceptical, but no more than sceptical about that we would still not have seen the Social Care Green Paper, and that we'd have had 5 delays to it, that it would become, despite not being a laughing matter at all, it would become a long-running joke and a figure of derision for this ever-delayed and denied Social Care Green Paper, which is absolutely critical. Because we know that up and down the country, millions of people, paid and unpaid carers, are getting up in the dark, coming home from work in the dark, working split shifts, double shifts, working for poor pay on insecure contracts. And they are not only the backbone of the social care system, they're the backbone of the National Health Service, they're the backbone of all the public services that we run. Because if our social carers, whether they're paid or unpaid, walked away tomorrow, if only 10% of them walked away tomorrow, all of our public services would come to a grinding halt. We need to do much, much better by them. And I hope that the government, in showing their sort of movement on this issue, intend to bring plans and public plans quickly. Because look at what the CQC said in their latest annual assessment. They highlighted concerns around cultural and geographic barriers to access of care, deficient regional staffing, a lack of stability in the adult social care market, and the government's failure to implement a sustainable long-term plan to fund social care. And they said that this directly impacts nearly 1.4 million older people and millions of people with disabilities or illness who don't have access to care and support they need. It is time for us to act. And I would say to the government to be brave and to be honest about this, because if it is current service users they are worried about when it comes to proposals, well, those current service users have very lived experience that the current system does not work. You have no need to be afraid of them when it comes to change. And if it's for millennials like me, well, we're also realistic. We know that the system that cares for our grandparents and mother is not going to be the same for us. Let's be honest about that. And those profound and difficult decisions that have to be taken as a result, let's get to that point. We don't need to be afraid, but also to be honest too. And I think this is a really important point. And I know the Minister of State, the member for Charnwood, is a good man and honest man. When it comes to funding at the moment for social care, we always see the Secretary of State or the Prime Minister use phrases such as "we've given access to X." I think it's £11 billion more. Be honest about where that money comes from, because the bulk of that money comes from a social care precept on the local ratepayer. And there is a political argument, I disagree with it fundamentally. There's a political argument to say, well, that the government believes that there should be a transition of the burden for social care from the national taxpayer to the local taxpayer. I would disagree with that. But if that is the belief for the funding of the social care system, Madam Deputy Speaker, the government ought to say so, because I think that's very important. And similarly, I know this is the health debate, but I'm not going to miss an opportunity to say we all must have a reflection moment on the BBC and the removal of that free TV licence, because we know that actually as part of someone's care, as part of their life, in their 70s and beyond, actually that television is an important part of it. And again, to be honest about why that's happened, because this is a cut that does land at the door of the government, despite what they might say. But failures in social care have a profound impact on the individual, we know that, but they also have a profound impact on the National Health Service. And I have a real passion for integrated care. I can't quite see the Shadow Secretary of State, but when I was his PPS, I used to bore him at great length about the virtues of integrated social care. When I was Health and Social Care lead in Nottingham for 3 years, it was by far the least popular thing I did. I had campaign groups at my door weekly saying that my enthusiasm for whatever, and there were flaws in the models around STPs, ACOs, ACSs, whatever rebranding we're at the moment. There were flaws in those models, but fundamentally, integrating a National Health Service with our local authority social care is a very good thing, and would lead to, if we did it properly, would lead to people not having to ring up multiple agencies to sort their loved ones' care. It would lead to proper seamless care that's based, rather than based around organisations, was based around individuals. So again, I say, Ed, let's be bold on integrated care. Let's be brave. She wasn't concentrating. I got away with it. Let's be bold about this. And actually, I think if you are, you will see the best of politics work, and you will see a lot of consensus build. I want to use my limited time available just to again reference public health. I'm proud of what I said around integrated health, and I'm proud of what we did in Nottingham. We did good things. One area where I reflect on my time in local government without pride is around public health. You know, we did do good things around trying to be more innovative with the public health grant, but fundamentally, because of the nature of the cuts that have come down the line over the last 9 years, we made cuts to public health services. I made cuts to smoking cessation services, a terrible public policy decision, because there simply wasn't enough money. That I'll happily give way.
Is he aware of the Health and Social Care Select Committee report today, which highlights the fact that there's been a 30% cut in funding for drug treatment services over just the last 3 years, which is catastrophic for those people involved?
I have to say, having had a long 4 and a bit hour vigil in the chamber, I haven't actually had a chance to see it, but I certainly will. But that is the picture up and down the country. That's the picture in Nottingham. And the key thing in that is, as well as being absolutely dreadful for those individuals affected, it is terrible for the system to not have those good interventions, often early interventions, around drugs and alcohol. Because if we let those things spiral, then the impact on the individual and the costs related to the system grow exponentially. These are really, really bad value choices to be made, and we could do much, much better around public health. So just to finish with a point around cannabis on prescription, we've had important conversations on this today. It's good that both the member for Hemel Hempstead and the member for Gower are here, and their leadership on this again has been absolutely crucial. I heeded very much what the Honourable Member for Hemel Hempstead said about how to characterise it, which is I changed my speech from medicinal cannabis to cannabis on prescription as a result. You know, I've had that case in my constituency, as many have, with a very, very frustrated parent who couldn't understand why their child didn't fit into the criteria. I'll happily give way.
Thank him for giving way, and it's a really important point he's making. I'm thanking him for changing his speech slightly. The reason it's so important is that because of the observational trials that we need to have, we need to know exactly where the THC is and the chemicals that comes from the cannabis oil, what the strengths are, what it is. So that's why it's prescribed medical use of cannabis oil is crucial when we make this argument, otherwise we'll lose the public's will.
I'm grateful for the honourable gentleman in improving the quality of my speech by adding that to it. But he will have heard, and I have a lot of confidence actually, and this afternoon has only grown that, he will have heard what the Shadow Secretary of State said, that if it is primary legislation that's needed, but clearly not, but whether it's regulations, whatever it is, in this place we are very capable of having a grown-up and proper conversation on this issue and coming to the solutions. I know that's what my constituent and her mother are desperately looking for us to do. So I will finish by saying, we are very grateful in Nottingham for our excellent health and social care staff. They do an incredible thing, and they keep our communities going, and they bring hope, and they bring proper enjoyment to life for so many people who are struggling with profound challenges, but they want us to do better. The Social Care Green Paper would be a really good chance to do that. I hope we could do that quickly. And integrated health and social care promises so many virtues if we got round the table and had a proper conversation about it. I hope we can do that. Thank you, Madam Deputy Speaker.
Mark Pritchard.
Thank you, Madam Deputy Speaker. I don't know about you, but I'm absolutely delighted that the age of austerity is over. And what we've heard from the front bench today is a commitment to more investment in the NHS, record investment in the NHS. And in my political lifetime, I don't think I've heard of any government of any political colour that is so committed to the NHS, and a Prime Minister and a Secretary of State that is similarly committed. And of course, that has to come on the back of a strong economy. It's not the magic money tree that we hear so often about in politics. And I'm also delighted that we're talking about something else apart from Brexit. And I hope that we can get the withdrawal agreement bill through, in order that we can get on to legislating, getting the Queen's speech through, legislating and making sure that these improvements to the NHS actually take place. But I'd like to go local for a moment and thank the Minister of State on the front bench and all of the team at the Department of Health for ensuring that Shropshire and the Borough of Telford and Wrekin have not lost out in this record investment in the NHS. In fact, in Shropshire, we're seeing the largest investment in the NHS in its history, in its 70-year history, £312 million. That is absolutely fantastic news. Now, what does that mean locally? Well, for my constituents in the Wrekin, it means that most of the planned surgery, that's the majority of surgery that takes place, that's what the majority of hospitals do around surgery, is going to take place at the Princess Royal Hospital in Telford. That my constituents will no longer have to take a journey to Shrewsbury for the majority of the reasons they visit their local hospital trust. That is good news. Now, of course, there is a debate at the moment around the accident and emergency ward, but I'm absolutely delighted that today from the Secretary of State we've heard that the A&E has been saved at the Princess Royal Hospital in Telford, and in fact will be the very latest in modern thinking on how A&E services are provided under the banner of A&E Local. Now, of course, some cynics say, well, maybe that's A&E Light. Well, it won't be as long as I'm on the case and my honourable friend for Telford are on the case, working together in tandem for local people, ensuring that we have an A&E that is providing what it needs for local people. And I'm glad the Secretary of State, in releasing the £312 million to Shropshire and the Borough of Telford and Wrekin, said that that release of funds is conditional upon the A&E at the Princess Royal Hospital in Telford being sufficiently run, adequately run, resourced up, getting the right staff levels and having the right expertise and clinical and medical cover that it requires to service the people of Telford and Wrekin. That is a commitment that he has given. That is a commitment that is very welcome from my point of view and on behalf, more importantly, of my constituents. I'm absolutely delighted also that we're going to see new services coming into the Princess Royal Hospital. And there's a lot of doom and gloom in some parts of the local media in Shropshire, and you'd expect it from opposition voices in other parties. But the good news is that we're going to see a new cancer unit. The good news is that we're going to see a new MRI scanner. The good news is that we're going to see an extra £7 million spent on completely modernised radiology services. The good news is that we've just recruited 180 nurses to the Trust. The good news, Madam Deputy Speaker, further to that other good news, is that we have now recruited 17 extra A&E doctors to the Trust. And if I may just digress for a moment, on the issue of recruitment, and that also overlaps into social care, I hope that the ministers will work closely with Home Office ministers around the points-based migration system to ensure it's not just highly skilled doctors that we attract from around the world, but also those that perhaps have fewer qualifications and skills, in order that we can provide that expanded social care service, whether it be from India or the Philippines, Commonwealth, non-Commonwealth, and indeed continuing to retain and recruit the very best from the European Union, where we cannot recruit domestically, Madam Deputy Speaker. So there are many, many positive things coming as a result of the Future Fit programme in Shropshire. And briefly, on the Women and Children's Unit, I'm delighted the Secretary of State today has announced an additional immediate £4 million to ensure that we're able to expand that unit and make sure that we have a quality, modernised, midwife-led maternity unit. That is good news as well. My appeal, finally, to the ministers on the front bench is on the issue of mental health, as I raised earlier today. Can we ensure that those veterans leaving the military, transitioning into civilian life, have a pathway, I'm very happy to give way.
I think mine from giving way, and he's touched on a subject which I didn't have time to, Madam Deputy Speaker, because of the limits, understandably, that were imposed. The dangers of just putting ex-military all into one box is, as I alluded to earlier on, some of them will be reacting to what they've seen and done almost immediately, and then some of them it will take years and years. I have friends from the Falklands, very close friends from the Falklands, that are only being diagnosed now with post-traumatic stress. So it's important that in the local communities, when they served in the armed forces many years ago, that the NHS understand their mental health needs around the country, and particularly in the Wrekin.
My honourable friend, right honourable friend, is absolutely right, and he knows, having served himself and been a former shadow health minister and a minister in many departments. He's absolutely right to underline that. I think we also need to see more encouragement of doctors, serving doctors going into the reserves in order that they can help and spot this. He's right to point out that post-traumatic stress, if not dealt with and intervened with early, can turn into the much more difficult and complex area of post-traumatic stress disorder. And he, like me and others across the House today, I'm sure would pay tribute to combat stress. They have a unit in my constituency who do a great job. Help for Heroes, the current campaign, which I've just referenced, about transitioning and making sure that those people leaving the military under medical discharge, particularly with mental health conditions, but other conditions as well, have a pathway of care with local NHS trusts in the constituencies they might live. Again, this is good news for Shropshire. There are still some battles ahead with ministers, and I will fight those battles with my colleague from Telford, but overall, this is good news.
Mike Hill.
Thank you, Madam Deputy Speaker, and it's an honour to follow on from the member from Wrekin. I too would like to begin by praising every healthcare worker employed by the NHS and in social care for the work that they do, including my own daughter-in-law who's recently qualified as a nurse. In the face of austerity, in difficult and arduous circumstances, with diminishing resources and never-ending cuts, they've worked tirelessly to provide the best healthcare outcomes for the people of my constituency. And as a Labour MP, I'm proud to say that the best traditions of our NHS, established by a Labour government, are alive and kicking in Hartlepool. Alive because the people of the town, together with healthcare workers, campaigners and the trade unions, have kept public health and NHS provision high on the agenda, fighting to keep our local hospital, demanding improvements to GP services, protesting against attempts to water down NHS and public health provision right across the town, and kicking because they've been swimming against the tide for far too long, with wave after wave of cuts hitting them squarely in the face and threatening to drag them under. But, Madam Deputy Speaker, the people of Hartlepool will have none of that. We lost our A&E in 2010 and stood our ground ever since. They wanted to build housing on hospital grounds. The people said no. They tried to run our maternity unit down. The people said no. The people stood strong and said our children should have the right to be born and registered as such in their own town. Madam Deputy Speaker, they are fiercely protective of their NHS, and rightly so. So what can they expect from the Queen's speech? Is it the return of A&E to Hartlepool Hospital? Not a cat and mouse chance. Will it be more money to invest and improve our hospital? No way. And no way too for any hospital trust across the Tees Valley, where in excess of £10 million is required to cover high-risk repairs, £5 million of which is needed to be found within my own trust of North Tees and Hartlepool. Madam Deputy Speaker, the truth is that pledges on NHS funding contained within the Queen's speech will have little impact on hard-pressed NHS acute services in Hartlepool. Nor will they plug the gap in mental health funding. And in regard to social care, the Queen's speech simply dodges the bullet by kicking the can down the road and fails to tackle the growing crisis in adult social care head on. And despite a continued 2% precept being placed by the government on council tax to cover adult social care, this is offset by a reduction of funding to our local council of almost £21 million, or 45% since 2013-2014. Madam Deputy Speaker, the wanton, in-your-face, upfront, daylight robbery of public services funding has to stop, and stop now, if we're going to tackle serious health inequalities and growing social care needs in places like Hartlepool. And the Queen's speech simply does not do that.
Pleasure.
Thank you very much, Madam Deputy Speaker. It's a pleasure to follow the honourable gentleman, and I share a number of the assessments that he made in his contribution just now. And because as this House pursues our debate on the Queen's speech, it is becoming ever more apparent that the casualty of a Tory Brexit will be Britain's National Health Service. The NHS is our greatest national asset. It's the product of that fusion of radical and enlightened minds in the last century that gave us healthcare for all, based on need, not means. And it is now, in this century, that the NHS is in great peril from a toxic combination of chronic underfunding and withdrawal from the EU, responding to very different challenges to that when it was first created so long ago. Now, notwithstanding the announcements in the Queen's speech, and let's be very clear, the NHS is not in receipt of the resources that it needs to be effective. And this was discussed only yesterday at the Health and Social Care Select Committee, when we had with us the Secretary of State. And we talked about that backlog of £6 billion in NHS repairs alone. So an announcement of half that really is no cause for celebration. We heard from the Health Foundation and their announcement, or their assessment of the Queen's speech funding announcement said, and I quote, "It falls well short of the scale of the challenge." We had a Prime Minister who announced 40 new hospitals, which then was downgraded to 6 within days. And we see demand for healthcare from our growing and ageing population outstripping the availability and quality of services, which means rationing and a diminution of quality of care. And many honourable and right honourable members from both sides of the House have referred to this so far in the debate this afternoon. I'll give way to my right honourable friend.
I'm very grateful. Does she agree with me that one of the other signs of a system under unacceptable strain is the fact that teenagers around the country are often waiting a year or more for access to mental health treatment? I've had 2 teenagers recently who've had their first appointment after a year of waiting, which seems to me to be utterly intolerable.
Well, I thank my right honourable friend for making that really important contribution. And waiting times are a particular issue in our NHS, and in particular in the Cinderella of all Cinderella services, in our children and adolescent mental health services, where we know there are too many young people right across our country who are struggling to get a referral, and then if they do get that referral, having to wait months on end. It's frankly unacceptable. I'll give way.
I'm very grateful to my honourable friend. There's a further problem with teenagers when they reach the age of 18, and the gap between the CAMS services and the adult services. And far too often, young people who've been given help when they are 16, 17, 18, suddenly go off the cliff and there is no support for them.
Well, I thank my honourable friend for making that very important contribution. This cliff edge that we see in our young people's mental health services, transitioning into adult mental health services, having to start all over again, having to repeat themselves. And there are a few places across our country that are creating young people's mental health services up until the age of 25, and that's to be welcomed. But that is the exception rather than the rule, and we need to do everything possible to make sure at that very fragile moment in a young person's life that they are having that continuity of support in their mental health services, because we know that it can have very detrimental impacts to young people being able to access education, to maintain relationships with their family and friends, to get into employment if they don't receive that very critical support.